talking about the vascular anatomy, right? So we talked about the 4 pedicles that the uterus is on. So we got the pelvic brim, we got the ureter coming over here. So what's the blood supply to the ureter? Is it the ureteric artery? Right? No, it doesn't exist. Okay. So above the pelvic brim, the blood supply is derived medial to lateral. Okay. So this ureter is gonna, it's parasitic. It just takes blood from whatever goes by. So it's gonna grab blood from the aorta, from the renal artery, adrenal artery, gonadal artery. It's just gonna take blood from those things that it passes. Below the level of the pelvic brim, it's now going to grab blood supply from lateral to medial. So it's going to grab off the hypogastric, it's going to grab off the iliacs, okay? So as we're talking about ureterolysis and releasing the ureter, our dissection typically is going to be here, and we're going to kind of release it that way. Now, sometimes these blood vessels don't read the textbook, and they're going to wrap around and come this way, okay? And so you'll run into, and you do want, I mean, you can devascularize the ureter, particularly in older patients, so you want to leave the sheath and the blood vessel intact as much as you can, even though you're skeletonizing it and mobilizing it away from, you know, here's your hypogastric, here's your uterine. So we have the water under the bridge relationship, so that's what we're seeing on the video, right? So, if we follow the ureter down, and then this hypogastric terminates as the medial umbilical ligament, okay? And you can actually grab that and pull it, and then that'll give you traction. You can follow it back down and see that actual vessel. So the uterine artery is the second to last thing that comes off before the anterior division of the hypogastric turns into the medial umbilical ligament. And what is that? What is the last branch? Superior vesicle, right? So we're securing the blood supply on the ureter and at the hypogastric. What if you accidentally skeletonized and sacrificed that? Well, first of all, you're not going to accomplish what you want to accomplish, and it's going to bleed a lot, right? Because you haven't taken down the uterine. That's probably the big issue. But there's plenty of anastomotic flow. So there's the superior vesicle, inferior vesicle on both sides. And if you've ever been in the space of Retzius, you can see all of those collaterals. In fact, to do a psoas hitch, we actually sacrifice the superior vesicle on the contralateral side to mobilize the bladder over to there, okay? Plenty of anastomotic flow. So, you know, the main issue with accidentally ligating the superior vesicle is that you didn't get the vessel that you wanted to get, okay? But those two things go that way in this space, and those are the only two things that go that way in this space, okay? Everything else goes vertically. Okay, so the point of all that to the question is, so we're gonna go ahead and skeletonize this, and we're gonna take this down. And I guess, yeah, so for the most part, you're right. For endo, you're gonna take everything down here, free the ureter so it can move away from the stuff that you wanna get. In these, that's not the point. The point is actually just to only identify the uterine and secure it there.